Hi, we're going to talk about Tai Yang formulas today, and especially we're going to start with the beginning, which is the first formula you learn, which is Ma Huang Tang. So you get Ma Huang at 9, Guizhi at 6, Xingren at 6, and then Jigan Chao at 3. So what does it treat and how often do we use it? I don't use it. Why? Because Ma Huang's prohibited in Australia, but also that it's the very first day of a cold and you don't really see that a lot. Now you can use it for asthma and it is very effective, but you still have to be in a country where ephedra and Ma Huang is available. So if you are, it can be quite useful for asthma. For the first day of a cold, you've got to catch it really quick. So for that reason, I don't use that much. We'll go through it quickly anyway. So the first thing is that your pulse will be floating and tight. Floating because your yang is coming to the surface to try and get rid of an external invasion. And tight because your main pathology is cold, not wind like Guizhi tongue. This one's cold. So generally we've got a bit of a schism with Tai Yang pathology. You're going to be a Ma Huang formula or you're going to be a Guizhi formula. So we're looking at the very beginning of a Ma Huang pathology, which means that the pores are closed tight, the joints are achy, and there's probably some stiffness in the neck. And the patient's most likely caught a cold, unless we're looking at an asthma condition where we can use this as well. Why? Because Xingren treats panting and Ma Huang treats panting. So you've got two herbs there that actually treat some kind of panting. So you will be looking for that pathology in that patient as well. So how often do you use it and how do you use it? You probably use it, take a dose twice a day and you might only use it for 2 or 3 days. Now, if it's an asthma condition, you may use it for a little bit longer until those conditions have subsided, and you may need to combine it with other herbs or into other formulas. But in that case, we'll look at asthma pathology when we look at pathologies. Today we're just talking about the formula. So in the Shanghai Lun, there are 9 total lines that mention Ma Huang. So it's a fairly significant formula in the Shanghai Lun. I won't mention them all now, I'll list them below. Now the other thing is that in terms of Kai, He, Shu, which means open, closing and pivoting, then Tai Yang is closed. It is too closed, therefore the surface cannot vent. So what we're trying to do essentially with this formula is we're trying to open the pores with the Ma Huang Xingren combination and the Guizhi. We're trying to allow the patient to sweat so that they can attain regulation of their pores through sweat. So we're again, it's functional medicine. We're trying to help the body do what it would do normally if it could, but it's a little bit stuck at. So we're just giving a little shift in the right direction to help the body sweat. So that's how the pathology is manifesting in this case. The lungs are not opening, so Tai Yang's not opening, but actually what's happening is the skin and the pores are closed, so there's a lack of easy breathing because of the Kai He Shu, because of the closing of the Tai Yang. So this is a Tai Yang channel pathology. So again, what are you looking for? Floating tight pulse, aversion to cold especially, and wind, but mostly cold, and also achy joints and possibly a stiff neck.